Hi, everybody. This is Pamela Kane. I'm the Vice President of Quality at Methodist Texan Hospital in San Antonio, Texas. So we're excited today to share with you the process improvement project that we did with a poster presentation here at our hospital. So I'm going to share my screen so you can see our poster, and then we will walk you through it. Okay. So the title of our project is a Telemetry Monitoring Process Improvement. We have the key stakeholders of myself, our Central Supply Chain Director, our ICU Director, Randy Shelifo, our Tele Manager, Stephen Gudowski, our Clinical Analyst, Stephanie Krug, and we definitely put together a collaborative multidisciplinary group to address an issue that we were having here at our hospital. So the problem opportunity was that due to an increase in the number of patients that were requiring telemetry monitoring and a limited availability of hospital-owned telemetry monitor portable boxes, we needed a process for tracking and accounting for the monitor boxes to meet patient safety needs. So what we did was we had to understand, with the critical patient safety event that came about, we had more telemetry orders for patients in the hospital than we actually had available telemonitoring boxes. So this and our quality team created a very serious safety issue, and we wanted to quickly resolve that, but we needed to engage the entire, the pertinent team members to help us make a new action plan around how to fix this. The rentals of these boxes, when we didn't have enough, were increased, and that was needed to cover the increase in patient volume requiring the monitors. There was a concern for financial constraints because owned telemetry boxes were being lost, and that was causing an increase in the prices of rentals. Also, we had a realization that the checking in and out of the boxes and the accountability in the current process relied very heavily on one person, which was the central monitor tech. For over 60 monitors in the hospital, one person was checking in and out all of these boxes. So we recognized that wasn't a very sustainable situation or a very good process. So we set our aim, our objective, our goal as specifically with a capital investment purchase of 15 new and 21 previously rented portable telemetry monitor boxes. We plan a reduction of rented portable telemetry monitor units by 50% by May 1st of last year, 2022, and a capacity to monitor 64 tele patients. We will also implement a process to prevent box loss. As you can see on our poster, we took several actions. The first thing that we understand is to actually make a process work well, engage the right people, and to be sustainable, you need to establish a multidisciplinary group. So that's the first thing we did in February. As noted by the people who were on this poster, it was a very diverse group across the hospital. Everybody had a different perspective initially on what we needed to do, but we got them together and we did a Gemba walk, which is a Lean Six Sigma first step in a process improvement. So we wanted to see currently what are we doing. We implemented weekly meetings to review the data and what current processes we had in place. The decision immediately was to move ownership of the teleboxes away from the centralized monitor tech and instead to the unit nurse leaders on each of the units with telemonitoring. So we had permission from our CFO to purchase sufficient teleboxes to allow 100% availability of a telebox for all 64 available monitors. So as soon as we were able to purchase those teleboxes, and you can see on our graph over here, we went from a few owned, a few rented to sufficient numbers to monitor almost 60 in March. And then by the end of our trial period in June, we had enough to cover the entire hospital with the new purchases, which is the safety concern. We provided education to all the frontline team members. We created sign-out logs for each unit and mailboxes on the wall to store any unused telebox with leads on the nursing unit. The prior process required the teams to take the box downstairs to a different room where one person was checking them in and out and not able to keep up with all of the duties. So we decentralized that and put some on each unit, sufficient for each unit. Then we continue to loop back for follow-up with all of the team members each week and understand how was this going. We have some of our data here. So talking about the post-Gemba walk and purchase of 21 rental boxes and 15 new boxes, We then got to a number where we had 64 owned teleboxes with 64 teletracker tags. We recognized if we put the teletracker technology on the monitor box, we could understand if the box was in the building or if it happened to move to a linen closet because it got wrapped up and thrown away, or if it exited the building, we could understand where the box was by using teletracker technology. We did install the 4 mailboxes, 1 on each of the inpatient units, so that there was a spot for each telebox in each nurse unit. And then, as we mentioned, ongoing daily monitoring. We have in our HCA hospitals a NATE technology, which is a dashboard to allow visibility of how many teleboxes are in use each day, each shift, and really work on that accountability piece. So in summary, the daily huddle report counts the boxes per unit. The nurse unit director is the primary source of accountability now. So by using checklists, which are hardwired tools to understand each shift, how many boxes do we have? Are we missing any boxes? And if we are, using some of that technology of teletracker to understand where a box might have gone, we have had a very successful transition to the purchase boxes. Out of 64 boxes, we only lost 1 in 6 months. So huge improvement over where we were in the past. We did learn a few lessons. There was a realization that each frontline nurse must be accountable for removing the telebox from the patient at the time of the discharge process to be successful in returning the box to the mailbox. When not held accountable, the teleboxes tend to leave the hospital on the patient or in the bed linens. And we also learned that the teletracker technology was not perfect. Since we did this project at the end of 2022, we have moved to a new system of technology, which is actually working much better to be able to understand where those boxes are at all times. So thank you so much for allowing me to present this project to you today, and I hope you can enjoy the conference.